Hello, my name is Michael Collins, Clinical Staff Educator at Kaiser Permanente Santa Rosa, and this will cover the documentation of the Spontaneous Awakening Trial and the Spontaneous Breathing Trial in HealthConnect. Here we have a brief overview of the Spontaneous Awakening Trial, also known as the SAT, and the Spontaneous Breathing Trial, also known as the SBT. It's important to remember that before either of the trials, a screening test must be completed. Charting begins on the shift assessment flow sheet in the respiratory group. By clicking on Yes in the mechanical ventilation row, the SAT-SBT group will then open. Directions for conducting the spontaneous awakening screen pop up when the SAT safety screen is selected. Directions can also be found on a laminated sheet attached to the ventilator. The SAT safety screen can be done every 24 hours or as indicated to assess readiness for weaning and extubation. If the patient passes the screen, the patient moves on to the spontaneous awakening trial. If the patient fails the screen, a drop-down menu will appear when the Reason Failed SAT Safety Screen row is selected. Once again, if the patient passes the Spontaneous Awakening Trial safety screen, the RN moves on to do the Spontaneous Awakening Trial, also known as the sedation vacation. During this time, the patient is closely monitored for agitation or any cardiopulmonary complications which may prematurely end the trial. If the patient fails the Spontaneous Awakening Trial, the Reason Failed SAT row cascades and the assessment stops. If the patient passes, continue on to document the RASS at the end of the SAT. When the Reason Failed SAT row is selected, a drop-down menu will appear, allowing the nurse to select the reason. Whether the patient passes or fails the SAT, the RAS must be assessed and charted. In order to pass the Spontaneous Awakening Trial, the RAS score should be between -2 and +2. After the successful completion of the Spontaneous Awakening Trial, the nurse will assess the patient for progression to the Spontaneous Breathing Trial by using the Spontaneous Breathing Trial Safety Screen tool. If the patient fails, the RN stops the assessment and notifies respiratory therapy. The row Reason Failed SBT safety screen cascades in. If the patient passes, the RN notifies respiratory therapy. If the patient passes the Spontaneous Breathing Trial screen, respiratory therapy is notified, and the Spontaneous Breathing Trial begins with the respiratory therapist making and charting the appropriate ventilator changes. Upon completion of the Spontaneous Breathing Trial, the respiratory therapist documents the duration and outcome. If the patient passes, they are ready for extubation. If the patient fails, the outcome is charted in the Reason Failed SBT row. Finally, before extubation, the physician is notified by the respiratory therapist or the RN to obtain an order for extubation. This concludes the documentation process for the Spontaneous Awakening Trial and the Spontaneous Breathing Trial. Thank you for your attention.